Hi, I'm Chad Watkins, owner of Current Insurance Agency, and I'm here with a brief message explaining the differences between Medicare Supplement plans. Now, these plans are going to be for every state with the exception of Massachusetts, Wisconsin, and Minnesota. Those three states actually have their own special rules that they use, so this would not apply if you live in those states. But for all of the states, we right now have 10 different plans. As you can see by the chart behind me here, that they are differentiated by a different letter of the alphabet from the letter A through the letter N. You will notice that there is no letter E, H, I, or J. The reason for that is because in June of 2010, the plans were modernized, and when they did that, they eliminated some plans and then they added a couple more. Now, these plans are designed to cover what Medicare doesn't cover in terms of going to the doctor and going to the hospital. Your Medicare Part A is your hospital coverage, your Medicare Part B is your doctor coverage. Over to the left of this chart, you're going to see the different things that these type of plans are going to cover, at least to some extent. Medicare Part A coinsurance, that is after the first 60 days that Medicare covers. It will cover an additional 365 days in the hospital. It's also going to cover Part B coinsurance. Typically 80% of your Part B doctor costs are covered by Medicare. This is looking to cover that other 20%. You have your first 3 pints of blood, hospice care, skilled nursing facility care, Medicare Part A deductible. Now this has gone up from $1,100 last year to $1,132. This is not an annual deductible. This is actually every time you go in the hospital. So if you go in the hospital a few times in 1 year, the first few $1,000s are coming out of your pocket. There's also Part B deductible. This is for the doctor. It's gone up from $155 up to $162 per year. So the first $162 is going to come out of your pocket when you have a doctor visit. Medicare Part B excess charge. This simply means that Medicare comes up with a figure that they allow doctors to charge you. The doctor is allowed to charge you up to 15% more unless you're in one of these states: Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. State law does not allow the doctors to charge a Part B excess charge, so you don't need coverage if you're in one of those states. For everybody else, they can only charge you 15% more. Foreign travel, if you happen to travel outside the United States, have an emergency, you'd have coverage there, and of course there is the preventive care. Now you're going to notice that all of the plans cover the Part A coinsurance. All the plans also cover preventive care. Your most comprehensive plan is Plan F. Now, if you notice, there's a check mark on every box, which means that all these things will be covered under Plan F, and that's what makes it the most comprehensive plan. Now, you might want to go with a different plan simply to lower the premium, because of course Plan F being the most comprehensive, it is also the most expensive. So sometimes you can switch over to a plan, lower that premium, and not lose much coverage, but you want to be careful when you do this, because there's some things that you really want to make sure that you are covered for, namely skilled nursing facility care. If you don't have this coverage, Medicare is going to cover the first 20 days. After that, you'd be paying $141.50 per day as your copay. So you really want to seriously consider having that coverage. The other one is the Part A deductible. Again, $1,132 every single time you go in the hospital. And you're going to notice that there are plans A and B don't cover the skilled nursing facility care. Plans K and L are only going to cover percentages of a lot of these things, so not very comprehensive. So again, Plan F is your best plan. Plan G is a nice option because the only difference between Plan F and Plan G is that Plan G does not cover that Part B deductible, again, that first $162 when you go to the doctor. But a lot of times if you can lower your premium by more than $162 per year, Plan G is going to save you money. Plan N is also one of the new plans. It's become a very popular plan. And again, the difference here, Plan N does not cover the Part B deductible. It does not cover the Part B excess charge if that's applicable in your state. And you do pay co-pays with Plan N. If you went to the emergency room, you're going to pay a $50 copay. And if you go to the doctor, it's a $20 copay. But other than that, it covers all the big things: the skilled nursing facility care, the Part A deductible, of course the Part A coinsurance when you go into the hospital. So that's a pretty good plan to help lower that premium, and you don't have to pay some small copays when you go to the doctor and the emergency room. So in a nutshell, that's the difference between the plans. If you have any questions, you can always contact me. My toll-free line is 1-877-377-7517. I look forward to hearing from you. Until then, I wish you the best in life and in health.